Ethical Practice in Advanced Nursing by Abigail Feit, Brianna Cook, and Kendrick Grasser. The objectives of this project are to analyze ethics, how ethics apply to advanced practice nursing, and discuss methods of developing and using ethics in advanced practice. Morality is the personal values, character, and conduct that governs an individual or group within a social context. It is the principle that determines good and bad, right and wrong. Ethics is a broad term that applies to the theoretical and introspective study about the morality of human conduct seen through action, choice, and character. While morality focuses on specific beliefs, values, and practices of an individual or group, ethics asks the question why, in order to understand the reasoning behind these beliefs and build a theoretical framework for moral conduct. Nursing ethics is a branch of applied ethics which determines the moral principles and standards that govern the practice of nursing. Ethics in nursing are essential for providing compassionate, fair, and effective care to the ill and the vulnerable, to ensure specific needs are met with respect, dignity, and professionalism. Let's discuss 3 key ethical theories related to nursing to help build a foundation of understanding. Utilitarianism is the ethical theory that states that a choice is right or wrong based on the outcome. In other words, the right choice is the one that gives the greatest good to the greatest number of people. Outcome-based utilitarian ethics are often used in disaster protocol decision-making where resources are limited. Deontology is the ethical theory that uses rules to determine whether a choice is right or wrong. This theory uses universal moral law as firm rules to follow when making ethical decisions. It's not concerned with outcomes, which avoids subjectivity. Having hard set rules are necessary when following protocols, administering medications, or carrying out a patient's wishes. Virtue ethics is a theory of ethics defined by moral character. The right and moral choice will be made by a person who has developed a strong moral character founded on virtuous habits. These virtuous characteristics are what makes nursing the most trusted profession in the United States. The first nursing code of conduct was published by the American Nurses Association in 1950 to provide a guide to daily practice and set primary goals and values for nurses to adhere to both professional and legal standards. The current nursing code of conduct is divided into 9 provisions, which address key components to ethical nursing: compassion and respect, commitment to the patient, advocate and protector of patient rights, accountability and responsibility, self-care and growth, ethical, safe work environments, research and scholarly inquiry, collaboration to reduce health disparities, and maintaining integrity of the profession. These 9 provisions can be categorized into 4 broad ethical principles: autonomy, the duty to respect others' personal liberty and individual values, beliefs, and choices; non-maleficence, the duty to not inflict harm or evil; beneficence, the duty to do good and prevent or remove harm; and justice, the fair, equitable, and appropriate treatment in light of what is owed to persons.
Advanced nursing ethical practice is the foundation for all nursing practice. Ethical dilemmas arise as nurses care for patients. These dilemmas may at times conflict with the code of ethics or with the nurse's ethical values. Nurses are advocates for patients and must find a balance while delivering patient care. Ethical decisions involve more than selecting the appropriate treatment or intervention. Ethical values are essential for a healthcare provider. Examples of competence in core ethical behavior skills include obtaining informed consent, assessing decision-making, discussing resuscitation status and use of life-sustaining treatments, advanced care planning, breaking bad news, and effective communication to the team. As an APRN, you must remain confidential, professional, trustworthy, and make good judgment calls to be able to recognize the healthcare ethical dilemmas. Application of principles of ethics in patient care. First off, we have clinical assessment. This is nature of illness, so acute, chronic, reversible, terminal, goals of treatment, treatment options, and probability of success for each option, adverse effects of treatment, does the benefits outweigh harm, medical surgical treatments, if treated, plans for limiting treatment or potentially stopping the said treatment. Next, we have patients' rights and preferences. This is information given to patients on benefits and risks of treatment. Does the patient understand the information, and do they give consent? Is the patient mentally competent? What are her preferences? If a patient is mentally incompetent, what are their prior preferences? Do they have a surrogate? Is someone else making these decisions for them? Next, we have quality of life. Expected quality of life without treatment, any deficits, physical, mental, social, any of this after treatment. Does this play a role in their quality of life? Who is the judge? Someone who cannot express him herself? Do they have a surrogate? Does this play into the quality of their life? Then we have external forces and context. This is research, education, considerations that can affect the clinical decisions, conflicts of interest based on religion beliefs, legal issues, public health and safety, any other organizations that come into play. Knowledge development is an ongoing process. As APRNs, we will have gained core knowledge in graduate education, but while societal issues change, new technologies emerge, new dilemmas and ethical problems will arise. The ability to be a leader in creating ethical environments involves a commitment to lifelong learning about ethical issues. As an APRN, you have more responsibility to take on. Moral action must be a core APRN skill. As an APRN, you will be the full participant in the resolution of moral dilemmas rather than simply an interested observer. First, gather information. Secondly, determine that the problem is an ethical one and identify that type. You could think about ethical theories, approaches to analyzing the problem. Fourth, explore the practical alternatives and then complete that action. Lastly, evaluate the process and outcome, like what went well, etc. Conflict in any workplace is a daily occurrence. Learning to manage conflict of any kind will make it less likely that individuals engage in behaviors that are destructive to their team. APRNs must be mindful that many issues leave a moral residue that continues to trouble participants involved in the conflict. The different approaches to addressing conflict could include collaboration, compromise, accommodation, coercion, and avoidance. The foundation of an ethical work environment includes respectful, productive interpersonal relationships and skilled communication. The more ethical the environment, the lower the ethical conflict. Preventive ethics emphasizes developing effective organizational policies and practices that prevent ethical problems from developing. The ability to predict areas of conflict and develop plans will be more proactive rather than reactive.
Barriers of ethical practice: lack of knowledge about ethics, lack of confidence in one's own abilities to name, define, and resolve ethical conflicts, lack of skill in communicating in high-stakes situations, time pressure, and a sense of powerlessness are potent barriers to the APRN achieving competence in ethical decision-making. So that means you just need to look for educational opportunities and evaluate your own personal beliefs. Interprofessional barriers: physicians and nurses may look at the same ethically troubling situation, but focus on opposing features and arrive at different conclusions about a course of action. Patient-provider barriers would be like cultural awareness, patient non-compliance. Organizational and environmental barriers are a lack of organizational support. So a lack of support for nurses who speak up regarding ethical problems in work settings is a potent barrier to ethical practice. Concerns can be ignored or minimized, causing moral distress. Overcoming barriers and using ethical practice. Collaboration between patient, provider, and other members of the care team is essential. You should have open discussions between nurses, providers, managers, social workers, caseworkers, anybody involved in the care team. Provide continuing education and training in ethical decision-making. You can provide different ethically challenging scenarios and decide how to handle them as a group. Create a group of nurse practitioners who can offer advice or guidance and schedule debriefing sessions. Go by the nursing code of ethics. Address reasons for non-compliance and resolve dilemmas in stages. Suggested methods of using and developing ethical practice. Lead by example. Show your team how you would handle different situations. Regularly assessing and improving ethical practices. Look for articles and journals that relate to current ethical practice. Ethical training. Practice self-care. Look within yourself to see what your values and your morals are. Overcome biases that you may have. Identify resources in and out of your institution. Respect the patient and their wishes. Ethical review boards. Preventive ethics, and practice ethical principles of nursing. Practice ethical decision making. Identify the problem, identify potential issues, check relevant ethical codes like the Nursing Code of Ethics, involve social work and other members of the care team, ethics committee if needed, and then implement your decision.